It looks like we're up again. Sorry about that, everyone. A little technical difficulties there. I'm assuming Facebook has a lot of Zooms going on, and so we got booted for some reason, but we're back, everyone. Thanks for joining us. We're with Dr. Bobby Koneru. I was going through his bio, which is very extensive. And, you know, if you want to know more about Dr. Koneru, just go to the recorded version of this video. You can learn a little bit more. But most importantly, the reason why you're here, Dr. Koneru, is because you have recently joined the county board, the Dubuque County Board of Health, and are helping our county through this COVID-19 crisis. So we're going to just start off. I would love to, know a little bit about what is the County Board of Health? What is the role that you play on the County Board of Health? And, you know, how is the county board helping us stay safe during this time of COVID-19? Oh no, I can't hear you. Oh. Unmute. I think you're on mute, Bobby. We cannot.
Can you hear me now?
Hear
All
you.
right. All right. Good. Well, sorry about that.
No.
First, I want to thank you for having me on. This is fun. Yeah. So the Board of Health, you know, its main purpose is to keep the community safe, right? In a nutshell. And it deals with a lot of different issues: chronic health, mental health. For example, the opioid crisis that was happening, vaccinations, if we're up to date as a community, and of course pandemics, which is what we're dealing with right now. So really, this has become the focus of all of our time over the last 3 months. And I'm just a small piece of the Board of Health. I mean, we have a fantastic team who really has been working around the clock. I'm a radiation oncologist, so I still am seeing cancer patients most of the time, and then I do put time in afterwards. But really, we have some other members on the team, like Patrice Lambert, who's the executive director. I mean, she's working day and night on this stuff. So.
And doing incredible work. She's incredible.
Yes.
Thank you, Patrice.
Yes.
Yeah. So can you explain to us just a little bit about, most of us are sheltering in place. You know, that's we're going out when we need essential issues. And we are, many of us, there are essential workers out there who are going out and doing things, but a lot of us don't get to see what's happening in the community. You're out there working, you're doing all of this. What does it look like in our community? What do our hospitals look like right now? What do our doctors' clinics look like right now?
Yeah, I would say, over the last several weeks, I have definitely become more and more encouraged as how our community has responded. I'm seeing people wearing masks when we go out now to the grocery store. That's a perfect example. That's a great metric for me. 2 weeks ago when we started recommending masks, I probably saw maybe 20% of people wearing masks in the grocery store and the other 80% not. And now I feel like it's the other way around. Maybe 75 to 80% are wearing masks, and I feel like the majority of us are really taking this seriously. We're social distancing, we're wearing masks, we're taking the precautions, we're washing our hands, we're hyper aware of our surroundings, all good things. And obviously are we still okay?
Well, it looks like, oh no, I'm hearing we're okay. My screen just shifted in some way, but I think we're okay.
Okay.
Okay, so you were describing what it was like out there, and
yeah, and obviously the clinics have had to kind of be the first responders. So we've had protocols in place for quite a while. Anytime anyone walks in, we check their temperature, we screen patients, on their history, if they're feeling any symptoms, if they've traveled outside the community. So I feel like we have some really good protocols in place, at least in the clinic. And I feel that as a community, we're taking, this seriously and taking our own personal steps to be safe. So that's encouraging.
Sure. Good. We, just so you know, for the record, it did boot us out again. So I'm not sure
what did
there, but
okay.
what we will do is we're just going to keep on recording
Yeah,
because we'll post this right in the event, and
sure, sure.
all gets out, the content gets out. So we might
No
not
problem.
take those live questions.
Yeah, yeah.
I'll invite their questions.
Oh, good. Chris is going to invite their questions, so we'll still
Okay, perfect.
get. So okay, great. Okay, sorry about that. Okay, keep on.
Yeah, so well, hopefully that answered your question. Was there anything else that you were looking for as far as?
No, just kind of
Okay.
those general
Yeah,
observations
yeah,
and what
yeah.
you're seeing. And then I would love to know a little bit, Dr. Koneru, about what is the County Board of Health up to these days? How do you fight a pandemic and
Hmm.
have mitigation efforts? What do those look like?
Yeah, so there's certainly a lot of day-to-day preparation activities, meetings that we're doing that has been behind the scenes that the community may not uh, be able to fully realize. But really, we've been very much um, following the lead of IDPH, the Iowa Department of Public Health, as well as the CDC,
Yeah.
and as they've been giving certain recommendations, we've been kind of going in step with them. For example, when they recommended the usage of masks, we also very aggressively started promoting masks here. We even were distributed, putting them out into the community so people could have access to masks. And now, really, our focus has shifted towards testing. As we're all aware, the numbers in Iowa have really been accelerating over the last days and weeks. Even in Dubuque, over the last several days, the numbers have been jumping up. So testing really now is going to be key. That's really our key focus now, as to make sure that we're still containing this virus, that we're going to be safe to eventually open up this economy.
Sure, sure. So, can you explain a little bit about the process of testing? So, if I start experiencing, well, maybe you can even back up a little bit. What kind
Yeah.
of symptoms does COVID-19 present with? And if I start feeling those, what do I do? What's the next step from there?
Hmm. Yeah, good question. COVID-19 is a little bit different than some of your other colds or flus, but there is certainly some overlap. The most common symptom is high fever. So a temperature of over 100 degrees, 101. Uh, that's present in about 80 to 90% of patients who have COVID. So that's one of the first screening questions we ask. Do you have a high fever? Or that's why we check your temp. Shortness of breath, cough are also really common symptoms of COVID. But now, we're also finding that there's a lot of other vague symptoms, like
Sure.
loss of taste. We're noticing that there's certain skin rashes that may appear with COVID. So there's a whole constellation of symptoms that are starting to become noticed that also come with COVID. But the most common ones are high fever, cough, shortness of breath. Those are the ones that really alarm us, and that would want you to come in for testing for.
Yeah, sure.
Yep, yep.
Okay. So, if I'm experiencing those symptoms, then what's the next step for me?
So the next step would be to call your primary care physician,
Okay.
tell them that you're having these tests, and then based on those symptoms, he would tell you then to come in for a test, basically.
Okay.
Yeah. So where there has been some frustration within the community is that patients or some people who have had some symptoms, they may not have qualified for the test, and that has led to some frustration, because we're in a very hyper anxious state right now, and anything that makes you feel kind of sick, or have any type of those constellation of symptoms that we're talking about, it puts you at a feeling of anxiety, thinking that, hey, do I have COVID, right?
Right.
But we're following a certain algorithm based on what the state has given us
Okay.
on how you would qualify to get a test.
Mhm.
Okay. Um, what we're in the process of doing now, though, is slowly expanding that algorithm so that we could start testing more.
More.
And there's two types of tests that you could do. One is a nasal swab test.
Yeah.
That's to help identify if you currently have COVID, right? And then the other test is an antibody test. And that tells you if you've had COVID in the past and if your body has created antibodies uh, currently in your system, which would hopefully keep you immune to COVID and reinfection. So I actually just had the antibody test done this morning for
Wow.
myself.
Sure. Sure.
Yeah,
You've
yeah.
been there.
So I'm excited about that.
Yeah.
Yeah.
Sure.
So it's actually available in Dubuque. You need a physician order, and you can go in, and it's $30 to take the test.
Okay.
Some businesses have already started doing this test
Okay.
um,
Wow.
as they're planning to reopen. So that's good. I mean, that's encouraging that we are having the capacity here in Dubuque to start doing antibody testing,
Yes.
and also we're ramping up to be able to do more screening um, on a larger scale. So we're getting there.
That's great. That is good news because yes, I know that there has been a lot of distress around people who are feeling sick and not being able to get access to a test. And I know that the Dubuque County Board of Health is ramping up those tests as well and working with the
Hmm.
state to make sure that Dubuque gets what they need.
Yes.
Yes, and I'm really glad to hear about the antibody tests. Someone did ask me that very question yesterday. How do I get it? So it's good to know we can call physician, our personal physician, put in an order. There is a fee, it sounds like, and then
Yeah.
you can get tested.
Yeah, and I think initially we're recommending that people who are maybe at higher risk, or there's a good indication to do it, so we don't run out of test supplies really quick. For example, if you're a healthcare worker, I think it's reasonable to get an antibody test just because you're always exposed to a high risk population, and not only that, but um, you don't want to reinfect somebody if you're sick. But if you've had uh, COVID before and you have the antibodies now, that's actually even better information, because hopefully that means that you're immune. You're immune to COVID moving forward for at least a while.
Yeah, that is good news. So, going back to a little bit back to the symptoms and getting tested.
Yeah,
Um, let's say I go get a test. How long does it take to get those test results back, and what should I do in the meantime?
that's a really good question. Right now, uh, the way it works is if you meet the requirements for the algorithm to get a test,
Yes.
the test is done, and then we send that to the state hygienic lab.
Yes. Okay.
What's happening right now currently is that the state hygienic lab is kind of over burdened with they've just been slammed with tests right now.
Sure, sure.
So there's a backlog, and sometimes that can take anywhere from 2, 3, 4, even 5 days before you get that result back.
Okay.
So the answer to your question, though, is if you're symptomatic enough to get a test, you should be isolating yourself anyways. Do not be going out and assuming you're negative until you get that test result back.
Yeah.
You
Yeah.
know,
Okay. I want everyone to hear that.
yeah,
Or if you are sick enough to go get a test, make sure that you are going home and isolating. So yes.
yeah. Assume you're positive until proven otherwise is the way I would approach that.
Great. So uh, I have a question live coming on about churches here in a second, but before I do that, I just want to follow the line of talking about this idea of contact tracing. So if
Yeah.
someone does test positive, what happens for those that they have been in contact with, and what does that look like? What does contact tracing mean?
Yeah, great question.
Yeah.
So if I could take a step back a little bit and talk about how some other countries have kind of handled this uh, in order to contain the virus. And let's talk about China. South Korea also did a great job. But what China did was when they, once they knew that COVID was a uh, epidemic and spreading, they pretty much sealed off Wuhan as a community,
Yes.
right? And they put it into lockdown. The lockdown was really just part one of the plan.
Okay.
And what the lockdown did was it enabled them to do really the big work that they were planning on doing, which is testing. Um, and within the testing, contact tracing was a really big component of really, um, isolating people who were sick or who were exposed to other people who were sick, and then separating them from everybody else. And that's really how they were able to start dropping down that infection rate and new cases. So unless we know exactly where the cases are coming from, they're going to continue to spread. So what contact tracing is all about is once we know, for example, that's, let's say Sarah has COVID. Well, everyone that Sarah has come into contact with, we need to test, whether they have symptoms or not, right? And then we need to continue. If Sarah's contacts are positive, we need to go and test all of their contacts. So that's really what aggressive contact testing is. And we have done a poor job of that in the country because of limited supplies of testing, reagents, and all these factors, right? So because of that, we got behind. Um, but in countries like China and South Korea, they were very aggressive about it, and they did it while the lockdown was there. It made it a lot easier then,
Sure.
right? And that's how they really were able to start containing the virus. So what we're doing in Dubuque is, we're in the process of getting, I believe, 1,000 new collection kits from the state, and we are beginning to do contact tracing more aggressively now.
Good.
So we're heading in the right direction.
Yes. Well, in the Visiting Nurses Association, they are such a great organization.
Yes.
They're all hands on deck helping
Yes.
efforts as well. So, but those test kits will really help, those extra 1,000.
That will really help. Yes.
Yes. Okay. So if a friend of mine I've been in contact with has COVID, then what would you recommend for me? Do I go home and self-isolate, or how does that work?
I would go home and self-isolate. If you're having any symptoms, um, definitely call your primary and see if you qualify for the algorithm. In the meantime, there's something called Test Iowa, which the governor has implemented. That is something you can get online, and you can do the assessment on there. And if you qualify for that, you can also get a test. Currently, that is only in Des Moines and a few other cities. It has not come to Dubuque yet. However, we're hoping that it will be in Dubuque, and if it doesn't come to Dubuque as fast as we want, we're ramping up so that we can do it on our own.
Yes.
Yeah.
I love the spirit of Dubuque. We all
Yes.
when there's a need, and so if the state can't get them here, then we're going to figure out a way. So yes.
And that way, I think we are very fortunate with the Board of Health, the Board of Supervisors. They're very proactive in trying to get what we need.
Yes, absolutely. Well, we did have a question from someone about churches reopening. So the governor allowed for that to happen. And so church communities can, if they choose to, gather again, although they do need to follow, public sanitation guidelines from the IDPH. But can you talk about, how does one know when it's safe to reopen or gather again in public? In Dubuque, we're still, kind of in a bit of a shelter in place. We're in the region, we hit a 10 margin. I think we changed based on some of those IDPH metrics. But, this particular person is asking any projections on when it will be safe to gather and worship here in Dubuque for churches. So one of the things she also mentioned in her question is people singing, and that
Yeah,
often
yeah,
spread things.
yeah. Those are all great questions. So I think we have to look at this on a couple of different levels. Number one, if you were to ask me when is it safe to reopen, I would say when new cases are leveling off and mortality and death rates are leveling off and actually starting to decrease. Um, I do think that sometimes you can't apply a huge blanket principle to an entire area. So I think the governor is doing a good job, at least in the sense of identifying areas that are higher risk than others and opening up gradually. I think that is the right thing to do. Um, with Dubuque cases still rising and our particular region in the state still rising rapidly, I don't think it's safe to reopen right now. Um, I'm hoping within the next week or two, the cases do start leveling off, the death rates start to slow down, that we can start reopening certain parts of the economy and the community. Going back to what I said earlier, um, in an ideal world, we would have been doing tons of testing and contact tracing for all of us to be able to feel a little bit more secure and have a more comfortable understanding of where the virus is and how much it's spread in the community. Without that information, we're kind of going in the dark. Um, so, will we ever get to that level by the time we open? I don't know. Um, the issue is we're on a tightrope. We're in between this place where if we don't open, there's some danger, and if we do open, there's some danger, right? So we're moving forward regardless. We're doing it slowly and in the best way possible, but there is probably going to be some risk with that. And there was a great article that was written called the Hammer and the Dance. I'm not sure if you've heard about that, by Thomas
Oh,
Poyolo.
okay.
I think it was a great article describing what we're going to probably experience in this country and probably in the whole world over the next 3 to 6 months. The hammer was the lockdown. The dance is when we reopen, and what's probably going to happen is that there's going to be this ebb and flow, the start and stop of the economy as cases come back, and we're going to have to take measures, and I think that's going to continue until we have a really effective treatment or we get a vaccine.
Yes, yeah. I like that. Okay, so everyone needs to look up The Hammer and the Dance. And who is the author again? Oh,
Thomas, and the last name is Pilo, and I can't remember how to spell it, so I don't want to butcher it.
okay. Well, I think that
Yeah.
my tech person already found it.
Oh, perfect.
So it's going to get out there, which is good. So
it's a great article. Yeah.
good. Well, and I think that's a good, place for us to conclude our conversation. The Hammer and the Dance, as we try to figure out how to do the dance.
Yes.
What, in conclusion, what would be the most important things that we could do personally as we're out there trying to dance through this time? What can we do to keep ourselves safe? What would you recommend?
Yeah. So I think that what the virus has done is that it has exposed our weaknesses, right? Not in the economy, for sure, but then in our health and in our healthcare system. Um, so I think what this has taught us or will teach us is that we have to take care of our health better. Um, the the best way in the short term, though, is to stay active, to exercise, to eat healthy. Out of all of that, probably the number one thing you can do to keep your immune system strong is to sleep well.
Yes.
To sleep well, right? When you have time, go for a walk outside, go for a run, start exercising, and then start eating healthy. And when you're quarantined for as long as we've all been quarantined, eating healthy is not always easy. But the good thing is at least the weather's warming up.
Yeah.
So hopefully we're going to be taking more walks outside and running, and try to get some good sleep.
Yes, yes. Well, those memes running around about, forget about the freshman 15, it's the COVID-19. That's ringing through in my household. So that's a good reminder, Dr. Koneru, that we need to, drink water, eat well, sleep well, exercise, and any other safety precautions in terms of masks out in the community, or what else would you recommend that as well?
Yeah, and those guidelines are not going to change. You remember after 9/11, there were some measures that we thought maybe temporary, but really just lived with us for even till now. I think I think that's going to happen here after COVID. We're going to be washing our hands a lot more than we ever have. We're going to be wearing masks a lot more than we ever thought we would have to. Um, and even the social distancing. I mean, these things are going to be kind of ingrained into our consciousness for a long time. So absolutely, those things are not going to change. Continue to wear masks, continue to wash your hands regularly, continue to social distance, unless we get some wonder drug or a vaccine.
Yes, yeah, and we don't know yet about either of those. Yes,
correct.
Yeah. Well, I think that's a really a good note to leave us on. So, Dr. Koneru, thank you so much for joining us and letting us pepper you with questions. And I look forward to, continuing to watch and help support your efforts in our community. So, and then for those of you who are watching, we are going to go live again on this Friday, with School Board President Tammy Ryan and our Superintendent Stan Reingens, and we are going to talk about everything schools. So COVID has changed and shaped our communities and our schools in very new ways, and so we'll get some more information on that. So join us 1 p.m. on Friday live here on Facebook, and thank you again, Dr. Koneru, for your work and for coming on. All right, you take care. Bye.
Bye-bye.